Professor of Psychiatry at Columbia University and founder of the Columbia Lighthouse Project, Dr. Kelly Posner. Thank you so much for being here.
Really grateful to be here.
This is such an important subject, and I guess as we've seen these two, the three now individuals who have believed to have taken their lives over PTSD, how big is this trauma that exists after a horrific event in somebody's life?
Well, let me start with the good news, because I think we all need a little good news. You know, suicide is preventable, and there is help for people who are suffering. But to your question, suicide is one of the world's greatest public health crises. It's the #1 cause of death among adolescent girls across the globe, second leading cause of death in 10 to 24-year-olds, kills more people than car accidents, more police than crime, more firemen than fire, and it touches 135 people are affected for every death. And these effects linger across generations because of the silence that often follows. And that's just our baseline. That's before you add these just unthinkable traumas. But like I said, the good news is we actually know how to prevent it. And what do I mean by that? What do we know we need to do? Did you know that 50% of people who die by suicide have seen their primary care doctor the month before they die? We need to be asking the way we monitor for blood pressure. Many adolescents who show up to the emergency department who've tried to take their own lives are not there for psychiatric reasons. So if we're not asking everybody, we're not going to find the people suffering in silence and connect them to care. But you know what we've also learned? Even that's not enough. The undersecretary wrote this urgent memo that we must go beyond the doctor's office. We must put a method to identify people at risk in everybody's hands. Parents, teachers, janitors, every single person, and find people where they live, and that's how we're going to connect them to the care that they need.
You talked about people suffering in silence. I think one of the things that sort of confuses people is that, we expect somebody when they're depressed maybe to withdraw. But here we have a father who just a week ago did an interview with CBS News talking in, not in an unemotional way, but he certainly didn't seem emotionally overwhelmed, talking about his daughter's death. What don't we understand about depression and the kind of depression that leads to suicide?
Yeah, well, people do suffer in silence, and we assume that they'll have the will to come to us and tell us that we need help, but they actually don't, which is why we need to go to them. And the biggest cause of suicide is this treatable medical illness called depression, but we don't think of it like we think of cancer. You would never hear the word choice when it comes to cancer. So people suffer in silence, and they actually want to be helped, but they don't know that there's help, and they don't know that this is treatable. So
you can suffer in silence but still do an interview on CBS News and look like you have it all together.
You can, because the brain-based illness really leads you to this black place that you're not able to come out of, and that's why we need to ask and we need to identify to connect people suffering in silence to the care they need. People want to be helped. My colleague who survived jumping off the Golden Gate Bridge, he said, people who are suicidal want to be saved. What we need is a culture where no one is afraid to ask.
Dr. Posner, let me ask you now about, I know we're focusing on these individuals who have taken their own lives, but now I wonder about this circle of pain and suffering. They've left behind people. For example, if you are the parents of that young girl from Parkland who survived the mass shooting and who has now taken her own life, how do those individuals go on? Because I think that's another issue that I don't think gets enough mention when we're talking about this, is the people you leave behind when you are suffering and you feel that you can't go on anymore, and then you take your life, and then you've got loved ones who are trying to pick up the pieces after you've left.
Right.
One of the things that loved ones suffer with is that, how could they have done this? And one of the things people need to understand, when somebody's in that pain, they actually think that they're relieving a burden from everybody else around them. And I've worked very closely with Parkland and the community and the parents who lost their children. And what's been really so admirable is turning their pain into impact. Empowering the community to do what they need to do to prevent these tragedies in the future.
Yeah, it certainly seemed like when we spoke to the kids down there that they were definitely drawing strength from that. But we know the way a news cycle works. It's been a year for Parkland in particular. Every year there's going to be less news coverage, less attention for that activism, less of a positive response for that activism. Yes. What happens after that?
Well, you know, my work with Ryan Petty and the rest of the community back when this first happened, you know, said we don't want this to be 18 or 19. So now they're taking the Columbia Protocol, which is a few simple questions.
Let's talk about that, the Columbia Protocol.
A few simple questions to identify who's actually at risk that can be in anybody's hands. You know, before, the parent or the friend didn't know what questions to ask. They didn't know what to do with the answers. The policeman didn't know who was actually at risk, who they needed to take to the hospital. So it's the first time that we have science-based questions to help us target who actually needs more help. It's the first time we're asking about, you know, what we need to ask about.
What are some of those questions?
Yeah, so it starts with, have you wished you were dead or wished you could go to sleep and not wake up? Or have you actually had thoughts of killing yourself? And if that's yes, have you thought about how you might do this? Have you had these thoughts and had some intention of acting on them? And that's when we know risk goes up 50%. And then also, have you started to do anything, prepared to do anything to end your life? And you know what we're doing there? We're getting at the full range of behaviors. You know, before we would miss the person that wrote the note or bought the gun or collected the pills in a simple question, and it kind of breaks down those barriers of stigma. We can ask, we need to ask, and people want to be asked.
And you know,
everyone should familiarize themselves with those questions. What were you going to say?
No, it's absolutely correct. And you know, when you read that the Washington Post says 223,000 students have experienced some form of gun violence since Columbine, there's an entire nation of people that will need help like this, and they're probably falling, or they're not on the radar of probably mental health professionals or even their own families and loved ones. So that's the...
And I wanted to say that those questions actually help us prevent gun violence, we believe. You know, 90% of shooters have suicidal issues. So let's ask a few questions and find people who need help, you know, before it's too late. President Obama's Deputy Secretary of Education said the Columbia Protocol can keep our 64 million children safe. We just have to get it in everybody's hands.
Look it up, memorize those questions. Dr. Posner, thank you very much.
Doctor.
Thank you.
So we should mention the National Suicide Prevention Lifeline is open 24 hours a day for anyone who needs help, and that number is 1-800-273-8255.